to Healthcare in Hawaii. I'm your host, Josh Green, emergency room physician from the Big Island, state senator. Today I'm really excited. I'm joined by a dear friend of mine, Dr. Ira Zunin. We're going to be speaking about integrative healthcare. Today's show, Integrative Medicine Explosion, here in Hawaii, is really meant to highlight some of the exciting things that Ira and other professionals in the healthcare discipline, MDs and other healthcare providers, are looking into as the healthcare system changes. Over the many years that we've seen healthcare change in the state of Hawaii, we've talked about healthcare shortages, that being a shortage of MD professionals. We've seen nurse practitioners and physician assistants join the ranks of healthcare providers in a very robust way. But today I bring Ira because he is an expert in this area specifically. Ira is a physician, as I mentioned. He's the founder of the Manakai o Malama Integrative Health Clinic and Rehab Facility. He's its medical director and its principal physician. And Ira comes to us with a perspective that is really without compare here in our state. He writes a column for the Advertiser, the Star Advertiser, Wealth of Health, which you can see every week. He's on The Doctor Is In. He actually is the host of that show on Channel 4, I believe, and then does so many other things. Ira has a master's in public health. He received his medical degree at UCLA. He's an assistant clinical professor at JABSOM. The list goes on and on. He also founded the Hawaii State Consortium for Integrative Health, which is really one of the focuses that we'll take on today. Ira, great to see you.
Thank you, Senator.
You bet. So I'm so pleased that you're here, not just to have a friend on the program, but because I feel that your level of expertise in this area, integrative medicine, is really unrivaled. So I want to spend this hour talking about what it is, what people can expect to see in the coming years, and really what your take on healthcare, which is frankly unique, has been for these many years here in the state of Hawaii. So why don't you tell us first a little bit more about yourself, fill in some of the details that I didn't mention very superficially in the beginning.
Sure. Well, you know, my medical school work was done at UCLA School of Medicine, but for 12 years before I went to medical school, I studied other kinds of therapies, Tibetan medicine, Chinese medicine, Ayurvedic medicine. A lot of that was through my undergraduate work at UC Berkeley in medical anthropology. And it really struck me that the best healthcare has to be modern medicine combined with traditional healing arts and a whole patient approach.
It's so fascinating because, you know, I just hear small vignettes in the community, but I've heard that Hawaii is perhaps more open to integrative medicine and to the multiple healing arts. What would you say? You're much closer to it. Is that true? Are we closer to having integrative healthcare systems than, say, California or New York or other states?
That's a question that's often asked, and I think the answer is split. On the one hand, it is more conducive here. We have a larger Asian population that is really you know, that comes from this kind of healthcare, right. That's comfortable with it, that seeks it out. On the other side, we really have a strong Hawaiian tradition, Lapa'au and Ha'a, just a great wealth from the indigenous side. At the same time, there's a very conservative medical environment, very traditional medical environment, and in some ways, Hawaii is behind the mainland in terms of what's going on in healthcare. I would say that on some level you could argue that California is further ahead with integrative medicine.
Interesting. That's fascinating to me because I see it sometimes through the lens of the consortium that you have, and I see all of those excellent individuals and professionals that bring all these different perspectives. Maybe in a second we'll have you unpack what the consortium is. And I see what you do at your center. First, actually, let me do this. Could you tell me what the title of your center means? What is it?
Oh, sure.
Yes.
Manakai. Kai is the ocean, the near ocean where the reef life is, as opposed to the moana.
Yes.
Mana is spirit, or in Sanskrit it's prana. In Japanese it's ki. So the healing, the spirit of the ocean, and Malama is healing or caring or taking care of. So the idea is the healing spirit of the ocean.
I get it. Well, I so appreciate it, and I know that the care that you deliver is very comprehensive, but also different in many ways than what one might see at a more kind of traditional, purely allopathic facility. maybe that's a good place for us also to start. When someone comes through your doors, because as far as I can tell, you have created the model of what integrative healthcare is. When someone comes through your doors, what do they expect?
Well, the expectations really vary depending on the person. But if we get at really what what it is that we do, or what does integrative medicine mean, it's really about bringing together the best of modern medicine and really we mean conventional modern medicine with traditional healing arts, with cultural sensitivity,
right,
with a whole patient approach. So in some ways it's a little bigger view and a little bigger tool set than you might get elsewhere. But some people come to see us strictly for a urinary tract infection or a cough or a cold, and we do regular medicine.
Right.
Other people come because they don't want to take any medication and they're looking for an alternative, but offered where there's a medical doctors present.
Right.
And our favorite patients, the ones where we can really help the most, are those that are interested in bringing together whatever works. A lot of it is lifestyle medicine as well.
Now tell me the kind of providers that you include in your practice. I know there's you as the medical director, and you have your training in, as you said, an array of the sciences, and then the traditional medical degree. But who are the other providers that make up an integrative clinic like yours?
Well, we have a large facility, and we keep expanding so we can keep bringing in new patients. We really have tried to set things up on an evolving basis so that anybody who wants an appointment doesn't have to wait more than a day or two.
Right, that's great.
But we have our medical department. It
Right.
includes family medicine, primary care. We have pulmonology. We have sleep medicine. Those are our physicians.
Yes.
We take care. We do women's health as well.
Yes.
We have departments for physical therapy, for occupational therapy, which is hands, but also it's activities of daily living, how to interface in the workplace, how to recover from a closed head injury. Then we have an acupuncture department,
Neat.
a massage department. We have chiropractic, and over the years we've generally had naturopathy.
Fantastic.
In addition, we have a sleep lab.
Yes.
And we have 4 psychologists, and including a neuropsychologist. It's
And
quite
that's
full service.
That is, and it's nice to hear that you have that large behavioral health component, to have psych services, because as I've seen in the ER, it's just a gigantic piece of our healthcare challenge.
Sure.
So you have a big team, and it's more than just a small clinic like so many people envision across the state. You really seem to have a large operation. How many years have you been running?
I've been practicing medicine for over 20 years. In this current facility, we have the whole 6th floor of the Honolulu Club building. We've been there 13. This is our 13th year, and then last year we opened up a sleep lab on the 4th floor. We're finding that as our population grows in size,
Right.
per person, meaning we're weighing more. We have this obesity problem.
Yes.
We're seeing a lot of diabetes, a lot of high blood pressure, a lot of high cholesterol, heart disease. But with that comes sleep apnea, and it's a terrible problem, and we're finding a lot of it.
It's so fascinating to hear, because we've talked on this program with other individuals about what their concept of the emerging healthcare challenges are, and you're really validating what a lot of them have said. As we are hearing, of course, amongst ourselves and with colleagues, this explosion of diabetes, hypertension, obesity, it's rapidly overtaking our capacity to care. But it sounds like you're kind of pushing back this tidal wave with a multi-pronged approach to work on it. Who are your most effective providers at the center?
Well, first I would say the most effective aspect of the center is really the collaborative nature. We talk to each other. We work together as a team. We
Yes.
communicate. We make plans together, and that is one of the greatest strengths. It's not only that we have all kinds of providers under the same roof.
Yeah, that was indelicate. I meant kind of what's your most effective approach, not because I can imagine
Sure.
each piece is equally valuable at the
Sure.
center.
I mean the whole idea is to get the right person to the right sets of treatments at the right time. But some of the real highlights are, as you mentioned, the integration of psychological services. We treat maybe 20% of the practice as chronic pain, and almost invariably, pain is isolating, and if you have chronic pain long enough, it's almost inevitable that depression follows. And sometimes depression is a predecessor to chronic pain and kind of leads to it. So to be able to treat depression, to have psychotherapy, have our psychologists on the job, at the same time we're doing the physical workup and treatment, we're seeing great traction.
It's interesting to hear that too, because we've both existed professionally through the era of seeing this explosion in pain medications out there, which both of us have been fighting against, working against that to solve that problem. And I've also watched people receive antidepressants for chronic pain, and that's been a part of the treatment plan. So I think that you're speaking to this problem in kind of a more global, even a more comprehensive way. That seems to be what I'm hearing.
I think so. Another area that we're really excited about now is our occupational therapy department.
Yes.
So our lead occupational therapist, Hilary Valentine, she's also a certified health coach. So she's really helping people with their activities of daily living. It's one thing to recognize, you can ask most people, is a French fry or an apple healthier?
Right.
And most people know the answer. But the question is, when do you do that comfort eating? When do you have that extra scoop of rice?
Yes.
When do you decide, well, I'll sit on the couch rather than get my exercise?
Right.
Well, our lead occupational therapist is a health coach, and she's a real motivator. So we'll provide the dietary and exercise recommendations, but she'll meet with the patients and make sure that there's clear goals set, there's follow through, it's doable, it's fun, and our patients are really reaping the rewards of that.
It's exciting to hear. I think this is a good time for us to take our first break. Sure. And when we come back from our brief timeout here, we're going to talk about how is the rest of the traditional healthcare system embracing this approach.
Right. Very good.
Right.
Thank you.
So I'm Josh Green with Healthcare in Hawaii, joined today by Dr. Ira Zunin. Thanks for being with us.
I'm Hong Jiang, host for Asia in Review on Tuesdays.
And I'm David Day, host for Asian Review on Thursdays. Both of us broadcast our respective shows at 4 p.m.
And my topics tend to deal with questions related to environment, culture, history, and sometimes human rights.
And my shows tend to be on international business, foreign policy, geopolitics, and national security. And you can watch our shows live on the ThinkTech website at thinktechhawaii.com.
And you can also watch us on YouTube or Olalo.
So come join us on Thursdays at 4 p.m. I'm David Day.
And on Tuesdays at 4 p.m., I'm Hong Jiang.
Aloha.
Aloha.
Aloha. Welcome back to Healthcare in Hawaii. I'm your host, Josh Green, from the State Senate and the Emergency Department on the Big Island. I'm joined by a dear friend today who I respect deeply, Dr. Ira Zunin. Ira has essentially been the leader in the integrative healthcare movement here in the state of Hawaii. In our first 15 minutes, he was able to lay down what goes on at his center, how they've incorporated multiple disciplines, all to the end of making a patient well. He talked about how he has health coaches and a sleep study capability and capacity at his practice, how he has traditional providers and he has other providers, not just in mental health care, but also in acupuncture, in chiropractic. He's had naturopathic colleagues with him over the years. So he's been able to embrace the entirety of the spectrum of healthcare. But we've, on this show, many times talked about healthcare reform, what the mandate from Washington has meant to us, how it impacts Hawaii, how it affects HMSA and Kaiser and HMAA and all these other insurers here in our state. So I thought this would be a good time, since I have the leader on this movement, this explosion in our state and I think across the country on integrative healthcare. I wanted to ask you, how have these other major pieces of the healthcare system affected it? How has the Affordable Care Act impacted what you do? Have the other insurers, are they ready to embrace really a much more global view of healthcare that you seem to offer?
Right. I think that's a great question, Senator. The healthcare reform, at its essence, is really this triple aim, where we're looking to create access to care, and that's been the job of the connector and so on.
Right.
Quality care, but at a reasonable cost. And what we found is that before healthcare reform is that physicians were just trying to see more and more patients for shorter and shorter periods of time and really responding and reacting to disease as it arises.
Right.
And really, so healthcare reform is about how can we get ahead of it?
Right.
How can we get ahead? How can we do preventive medicine? How can we do lifestyle medicine? How can we prevent illness? How can we engage patients in their care, actively in their care, in their lifestyle, diet, exercise? How can we be attentive to the social and psychological aspects of care? And really, this is what integrative medicine has always done. So when I saw healthcare reform start to make its footprint, I realized that there was an enhanced role, sort of an unprecedented role for the care that we've always provided to contribute.
Now, isn't it true also, I'll ask you many more questions about what you just said, but isn't it true that there is, in the federal statute, a mandate to actually integrate healthcare, to begin providing the larger spectrum of services, many of which you are leading on, into our healthcare system? Could you explain that a little bit?
Sure. Well, I think we all saw a couple weeks ago the fry that Senator Harkin had with Hillary Clinton. Senator Harkin, who's retiring out of Iowa,
yes,
he was the one who put the original funding in the budget for the Office of Alternative Medicine at the National Institute of Health,
okay,
inside the Center for Disease Control.
Right.
And he also put another clause in the Affordable Care Act called 2706 that essentially says carriers cannot discriminate against providers as long as they're acting within their scope of practice.
Okay.
So that if an acupuncturist, for example, is acting within his or her scope of practice, that there can't be discrimination with other providers. So it doesn't require carriers to offer new services or to change their benefit plans,
okay,
but it requires carriers not to discriminate among any willing provider whose scope of practice it is to provide a given service.
How does that translate here in Hawaii? For instance, you described in our first few minutes that you have this really wonderful complement of providers at your center. What does that mean then when you apply 2706 to what you do? Does that mean that now it'll be more possible to include them in kind of the, quote, mainstream approach, meaning they can see more patients, bill more in a kind of a regular visit way? Or do we still have work to do? Where are we?
It's still early days. It's still early days, Senator, and I think that the carriers are very sensitive to 2706, but there are a lot of ways that it can be done inappropriately or incorrectly that can cause harm to patients, increase the cost of health care, end up causing employers to pay for premium dollars that really aren't what they had in mind. So it needs to be done carefully and deliberately. But I think that as the carriers begin to get their arms around how to make this work, and the providers, the complementary providers who really haven't been that much included, begin to acculturate and understand how to function in that system, as all of that begins to settle down, I think we're going to have a better healthcare system. And I think that in the end of the day, we will see more reimbursement for acupuncture, massage therapy, chiropractic, naturopathy that we're not seeing now, that we haven't seen so far. But I think that there's really a good and safe way to begin to look at it.
Yes, and I have heard, and you'll have to forgive my ignorance, but I've heard that actually it's overall. I had seen some studies and some articles several years ago that suggested that by even integrating healthcare and adding some of these services right in the mix with the overall allopathic model, that even though many people would like to avail themselves of these services, because they're basically low impact, low cost modalities as compared to major surgeries, big time hospitalizations, pharmaceuticals that cost $50,000, $60,000 a year, $130,000 we're hearing for Sovaldi, this new treatment for hepatitis C, that it actually would have a relatively negligible effect on the bottom line of healthcare as compared to the large healthcare spend in our country, while at the same time maybe even decreasing some costs and decreasing our need to have, say, heavy narcotic pain medication, which we in our discipline have often had to prescribe for people. Sometimes these modalities will help people with those problems. Is that your experience?
Absolutely, it's absolutely my experience, and you can look at these services as among the very least expensive and among the very safest services there are. If you take a total hip or a heart surgery,
right.
An open heart surgery, I mean, we're talking on the order of 100,000.
Right.
It's not a 10,000. It's not a million. So, depending on the surgery and complications, so put a joint replacement at roughly $100,000.
Right.
That means 1,000 acupuncture treatments,
Wow.
1,000 chiropractic adjustments, 1,000 of any one of these.
Yes.
I mean, there are thousands of research studies that show efficacy and benefit, good outcomes for all of these CAM modalities. There can't be but cost savings.
Yeah.
And that's on the purely medical, on the utilization side. These services also are, by and large, focused on prevention, not intervention.
Right.
They all include an element of diet, of lifestyle, of relationship medicine, of psychosocial and spiritual medicine. And somebody who's happy and balanced and well-adjusted also tends to have better health and cost the system less.
Right. Let me dig into that a little bit because it's so interesting to me, and it's really pleasing to see a colleague working in this field, frankly. But my traditional experience in the ER and when I used to work in the community health center system was very easy for the insurance companies to see what you did, put a code on it, pay you or not pay you for it. But when you start talking about the whole person or engaging in education, what I wonder now is how is the system reforming itself so that it can respond to that? If you were to say, bring a patient in for not your usual 12-minute visit where they run in and run out and they leave with a prescription for some tablets for whether it's their joint pain or their blood pressure, but when you spend a couple hours with a patient having had them see multiple professionals, is it possible that the insurers and others can understand that they are investing properly in that visit, that they can pay enough to support the professional staff that's necessary to deliver, which is very clearly a lot more service than I ever delivered in a short visit.
Sure.
So how is that model changing? How do you address that?
Well, first of all, it's been cumbersome over the years to take the existing paradigm and have ethical and honest reimbursement for the way we practice medicine.
Right.
We've managed, but the carriers now are really beginning to rethink it. We did some years ago do a pilot project, a very large pilot project for one of our largest carriers, where we took care of chronic pain patients, and we found that by having these patients go through a 12-week program where they received all their services as a group,
yes,
acupuncture, psychotherapy, meditation techniques, therapeutic movement, that they reduced their opiate use significantly, they improved their function significantly, many of them got back to work,
yes,
and they also reduced their utilization of services.
interesting.
The most exciting part of that is that their quality of life improved,
Yes.
as reported by these standardized tests. And a year later, we checked them again, and their quality of life had continued to improve further. Less anxiety, less depression. So it was very inspiring that one of our carriers was interested enough to make that kind of investment, and then they could see those outcomes.
Right.
But the other big change that we're seeing now is this concept called patient-centered medical home.
I was about to ask you about that because it's interesting. What you just described to me actually seemed like a much more enlightened version of the patient-centered medical home, which I have really no axe to grind. I've been very appreciative of HMSA's leadership and others in our state, like Calvin Sia, who was one of the founding describers of patient-centered medical home. Really wonderful work that Hilton and Mike Gold and others have been pressing, and we've talked about on this show even. But it sounded to me like you were describing a patient-centered medical home that really outstrips this traditional PCMH or patient-centered medical home, which involves a lot of process measures and check boxes, good attention to key health problems, but I'm not certain that I've heard anyone express, like you did, a real transformation of people's lives. Can you reflect on the differences between the patient-centered medical home and the integrative healthcare model?
Well, let me say, I think you mentioned Mike A. Gold and Hilton Raithel,
Right.
and I'm really firmly convinced that the new leadership at HMSA has a new vision, and that vision is really focused on prevention. It's focused on patient engagement, and I really believe they're serious about that, and they've already made some progress.
I do too.
And so the first step was to create these patient-centered medical homes that make sure that providers go through these certain measures. So if you're diabetic, you have to check your eyes. If you're diabetic, you have to check your heart every year.
Yeah.
Well, that's good. It should be done. But there's so much more.
Right.
And really the exciting part of patient-centered medical home is that it doesn't have to be the physician. We're the most expensive parts of the system.
Right.
Well, it's our pen, or now it's our keyboard that's the most expensive part of the system, what we order.
Right.
But there's so much that physicians have traditionally done that physicians are not best suited for, and it's not necessary. You know, our best role in the end of the day is to be good diagnosticians for complicated cases and to provide high-end procedures when they're indicated.
Right.
Almost everything else can be done by other providers that are well-trained, knowledgeable, inspiring, and really in a position to serve that triple aim of access, because they're more available and easier to access, they're less expensive, of quality care, and by doing it that way, at reduced cost.
It really sounds, that's an eloquent way to put it. It sounds like some of the leadership at HMSA and other people in our state have laid the foundation for patient-centered medical home, but now we have the opportunity to really take it and run with it, take it to the next level, and begin to deal with some of the psychological components, the behavioral components, the issues that really take quite a lot more work than even the basics have allowed. So why don't we take a break here? We're halfway through the hour, and when we come back, we will begin to explore your philosophy of medicine and where you think it's going to go in the future.
Thank you.
You bet.
Thank you. Very good.
I'm joined today by a dear friend, Dr. Ira Zunin, and I'm Josh Green, your host of Healthcare in Hawaii.
Hello, I'm Martin Despang, and I'm the host together with the one and only Ali Yamashita, and our show is called Urban Transcendence. And Urban Transcendence is about identifying where there's a unique situation of a vibrant city in one of the most beautiful natural environments. So how these two can coincide, sometimes conflict, how they could find reciprocity in the 21st century is what we're excited about. And we're planning on bringing in a diverse body of guests, both from the arts and the science and the established and the wise and the emerging generation. So hope you will join us. We'll always be on Thursdays from 1 to 2 p.m. Thank you.
Aloha. Welcome back to Healthcare in Hawaii. I'm joined by a leader in healthcare in the state of Hawaii, Dr. Ira Zunin. Trained at UCLA, he has a master's degree as well, and he leads at his center, which he founded many years ago, Manakai o Malama. We're talking about integrative medicine today. Now, over the past several years, we've witnessed healthcare reform, the Affordable Care Act, and so much change in our healthcare system. And many changes also have occurred here on the ground. HMSA has really been a leader in our state on prevention. They've looked at ways to reform the payment system, but they've relied on physicians and nurse practitioners and physician assistants and other allied healthcare professionals to really help them change the system. But this gentleman, Dr. Ira Zunin, has an entirely greater perspective on healthcare and how we can go forward in the future. So I'm going to take these last 15 minutes or 13 minutes of our show to ask Ira, what is your vision of healthcare for the future? How can the things that you do at your center really impact the greater state of Hawaii?
Right. These are exciting times. There's no doubt about that. And you know, when there's exciting times, there's also fearful times. There's change, and the change hasn't been easy. You know, there are so many of us who've worked hard, particularly in the smaller practices, and the change has been overwhelming.
Right.
But as we're getting through healthcare reform, we're really beginning to see light at the end of the tunnel. We had talked a few moments ago about the patient-centered medical home.
Yes.
We talked about integrative medicine as sort of this idea of bringing together the best of modern medicine and traditional healing arts in a kind of whole patient, whole person approach.
Right.
I think that as these patient-centered medical homes continue to evolve, what we're going to see is programs. You know, if you create a special program for a problem that's difficult to solve, and there are a lot of them, where you can bring different kinds of providers together,
Right.
that's where we're going to see the very best outcomes.
So that's an interesting comment because as we've discussed patient-centered medical home with Hilton here at this table, and I think 2 weeks ago we had John Houck join us when we were talking about what's going on at Queens with their clinically integrated physician network. We spoke in abstractions about the patient-centered medical home, but we didn't get into the programmatic changes. They spoke quite eloquently about how they see this, this movement growing, but it didn't translate in my mind into ways that we would take care of problems that have been much too large for our healthcare system to grasp. And specifically, when I'm in the ER, I see many, many patients come through, which I know the main reason that they've come into the hospital is because they're traumatized psychologically and psychosocially. 15-year-olds that have major drug problems, incredible problems at home, violence occurs, and then they're injured and they're in the ER. Individuals with very advanced drug addiction that have now, kind of wreaked mayhem on their bodies, and they look 30 years older than themselves. Problems that can't be solved by some of just the basic nuts and bolts of patient-centered medical home, which brings us, I think, to you, which is to say there are larger challenges out there that require a slightly different approach. Is this the place that integrative medicine will weigh in? Is that
Yes,
how it's going to happen?
I think so. I think that's where integrative medicine can make its greatest contributions, not just to healthcare, but to society. And first, let me just thank you. I know you spend these long weekends in the emergency room over on Hawaii Island.
Yes.
And I always have a lot of gratitude for my colleagues who are right on the front line there, taking care of some of the most difficult problems. But we try to take half a step back and really spend time bringing a whole team to bear to solve these issues.
Yes.
We do it with chronic pain,
Yes.
where we bring together our psychologists, our physical therapists, our occupational therapists. We work with medication. Sometimes we'll work with vitamins and supplements. We might use herbs to effect change. We'll draw in the patient's family to create as much support as possible. And we'll also bring patients through programs as a group. As a group, they bust each other. You know, it's one thing to give a doctor a story, a different doctor a different story every week or two. But if you're sitting with the same group of patients who have the same issue, they'll say, "Hey, Joe, I'm busting. You said that last week," right? And they support each other. So this group work is really helpful.
I think that's so necessary because to give people perspective, let me describe a patient, a very, very sweet person who has major challenges with drug and alcohol addiction. This individual has come into the hospital no less than 50 times in the last 3 years, often near death. The addiction issues have gotten the better of the person, and they've had to be admitted for any number of problems, from liver damage to vascular problems, strokes, major bleeding. I would estimate that this person has spent and had to have more than maybe $2 million invested in their care over the course of 3 years. And I can tell you, each time I've seen them, they're no better off for having had advanced technological treatment for that stroke, for the bleed, for the addiction. They haven't gotten any healthier, and they're gradually coming to a point where they probably won't make it through one of these ER visits. And I can only imagine what even a half of that $2 million, and it's not about money for me, but half of that investment in something that didn't make them healthier could have done at an institute that provided an integrative, holistic approach to that patient. So I really think that you're more than just onto something, but it's becoming a necessity that we move out of our very siloed approach to allopathic healthcare, even pretending in the ER that we're helping an individual, and look at how could $1 million have been spent on 150 individuals that were all working together.
It's amazing. It's amazing. And then there's other issues completely on the leading side. Mother has a 5-year-old child who starts kindergarten. Is told by the teacher that or you think there may be some issues with your child. Please take them to a psychiatrist. 10 minutes later, they walk out of the room with a prescription for Ritalin or Adderall.
Yes.
We look at that as well. We have been exploring with more comprehensive workups, neuropsych workups, and using a new piece of technology to really make sure a child does have ADHD. And we'd like to begin to work with children and their families in a group setting as well to help manage that without having to rely so much on the amphetamine treatments that are all too common.
Right, and amphetamines are kind of a core problem or challenge, I should at least say, in our society, right? We've lived through the methamphetamine crisis that we had in Hawaii, and persists. I think for some of our viewers, they're very aware of that. And then to be giving prescription amphetamines, which in some cases we know is necessary, but in so many cases I worry what those medications do. I remember there was a period where on Big Island we were seeing a lot of individuals receive care for acute psychosis with very strong medications that caused incredible obesity problems and very big challenges with diabetes. People gaining 100 and 150 pounds. And I knew that at the end of the day we probably were doing them harm. We were managing a symptom and creating a lifetime of health challenges. Sure. And I would have been so much more pleased if they could have gone to an integrative center where they could rely on 3 or 4 different professionals perhaps that had behavioral health experience, plus an MD, plus someone that could work on, goodness knows, acupuncture or whatever other modality seemed to really help them. And I'm hopeful that the insurance industry and the healthcare universe is going to catch on to what you're doing, because yes, we can patch problems, we can put our thumb in the dam, but so many human beings are out there living and suffering, and I'm not sure that the current healthcare model is helping some of those individuals. You have a few minutes left to really tell us about what you would like to see. How would you like to see integrative medicine grow? How would you roll it out if you were going to be a responsible professional like you are?
Sure, I think that's a great question, Senator. First I want to say I'm very inspired by the way the payers in Hawaii are beginning to look at it. I think that we're all on the same page, and we're all seeing that really actually the single biggest problem is the obesity.
Yeah.
Once we weigh more, we get diabetes, we have high cholesterol, we have high blood pressure, we get heart disease, we have kidney failure, our joints buckle, we get chronic pain.
Depression from personality challenges and so on, yes.
So it's a massive problem. And I think that the future of healthcare is really about continuing to cultivate these patient-centered medical homes and to make sure that they also affect the inappropriate emergency room visits, the hospital readmissions, and work in a way that really treats the patient as a whole person. And really, well, how do we do it? The way we do it is we bring a broad range of health providers, psychologists, physical therapists, occupational therapists, acupuncturists, with medical providers, physician's assistants, nurse practitioners. We bring these teams together and we provide services not a la carte in the community, not necessarily a la carte in the patient-centered medical home, but as a group focused on ADHD, a group focused on sleep apnea and insomnia, a group focused on chronic pain, a group focused on obesity and diabetes. And those cluster treatments with the right providers and group support is really the way to achieve the triple aim: lowering costs, creating access, and creating really quality care that our patients appreciate.
And I think what you're doing is you're adding a kind of a new piece to this puzzle, which is you're essentially, because I've heard a lot of people wax philosophic about patient-centered medical home, but you're also saying something additional, Dr. Zunin. You're saying add a component that is a center of excellence. give some of this capacity to people who are very confident in their capacity, whether it's someone at your center or at Straub or Queens, wherever, but that is comfortable integrating services, but at a very high level of capacity and competency, so that we actually get results that are clearly demonstrated at the bottom line level. We're not naive here. We know that people have to pay for health care, and it's very challenging for businesses and individuals. But take the patient-centered medical home, wrap a center of excellence bow around it, and run with these programs to actually solve healthcare problems.
Yes, and use different facilities where that expertise is around the community, around the islands. You know, we're good at chronic pain, we're good at sleep apnea, we're good at diabetes and weight loss, we're good at ADHD, but other centers are excellent at Alzheimer's disease, Parkinson's, neurodegenerative disorders, geriatric issues, end-of-life issues. You know, so oncology. We have these centers of excellence, and to be able to use them in a more collaborative and cooperative manner is really the way to lower costs while increasing quality and really giving patients what they need and deserve.
And I think that also speaks to our capacity challenge, because here we are in the islands of Hawaii. We don't, as we know, have a full complement of providers. We're short. Kelly Withey has been very eloquent describing the shortages in the different provider mixes that we sometimes suffer. But I think you are onto something very important, because it sounds to me like that by collaborating with colleagues and taking the best from each of our areas of excellence in our training, that we can actually deal with that shortage challenge, we can deal with what's become a high cost of healthcare challenge, and actually get people better care. But we're going to have to be smart about it, and we're going to have to take what this foundation that has been given to us by patient-centered medical home experts like HMSA and take it to that next level. And that, it appears to me, is what you're working on.
Yes, I mean, that really is the integrative medicine explosion we're seeing today. I think that the carriers get it, patients get it, providers get it.
Okay.
It's exciting times.
Okay, well, I think that unbelievably wraps up our 45 minutes together, so I'm so honored to be with you. Great to see you. You too. This is Josh Green, Healthcare in Hawaii. I've been joined by Dr. Ira Zunin, a terrific show. I hope you'll keep following us. Thanks for joining us today.